Neurovascular relations are important on this posterior compartment. I'll talk about the ones that are passing up through the scapula in more detail when we look at the blood supply to the upper limb. But really, I just want to focus in on these muscles that are these blood vessels and nerves which are passing out of the triangular interval. We can see it here. Reminding ourselves that the triangular interval is formed medially by the long head of triceps, superiorly by the teres major muscle, and laterally by the humerus. We can see these nerves and these blood vessels are leaving the axilla and passing to the posterior compartment. We can see up here we have the axillary artery, and that is eventually becoming the brachial artery, and coming from the brachial artery we can see just here we have the profunda brachii artery. Here we can pick up the profunda brachii artery running in between the medial and lateral heads of triceps. It is accompanied by, if here remember the posterior cord, the radial nerve following the profunda brachii artery. And we can see the radial nerve now passing down to this posterior compartment. So remember the brachial artery as the axillary artery were in the axilla, and the posterior cord was in the axilla. And to pass out from the axilla to the posterior compartment, these structures had to pass through one of those spaces. Here they've passed through the triangular interval. So, separating the long and lateral heads of triceps, we've got the radial nerve and the profunda brachii artery. They pass to the posterior compartment via the triangular interval. The radial nerve from the posterior cord, the profunda brachii from the brachial artery. So in this lecture we've looked at the brachial fascia and the intermuscular septa that separate the arm into compartments. We can visualize that with the arm in cross-section. We then looked at the anterior compartment of the arm, biceps brachii, brachialis, coracobrachialis. We looked at their function and their neurovascular relations. We looked at the cubital fossa, its boundaries and contents. And then we looked at the posterior compartment, specifically triceps brachii, its function, and the important neurovascular relations.